Role of domesticated pets or companion animal in transmission of zoonotic disease. Role of domesticated pet or companion animals in transmission of zoonotic disease. Our cave-developing ancestors used dog as the co-partner in human job. Subsequently, in all civilizations, dogs were used as a guard, companions, and hunters, and in time of war. So, first pet animal of man was dog, then cat, horse, and some birds. Pet animal kept for pleasure and companionship are usually domesticated and selectively bred for coexistence with human beings. Besides their value as pets serve ut- uh, utilitarian purposes, protecting homes and properties, destroying vermin, and providing means of transport. At least 40 different diseases can be transmitted from pet to people. They may be acquired from direct contact with infected animal or from the animal's extra. Sometimes just breathing the air in the vicinity of man infected pet can cause illness. We are so fond of one another because our ailments are the same. There is close association between domestic animal and human population, rural, urban, agriculture worker, veterinarian, butchers, which lead to transmission of zoonotic disease for animal to human beings. Two-thirds of the domestic animal were reserved from many zoonotic diseases. The incidence of zoonotic disease depends on the number of infected animals, route of transmission, level of interaction between man and animal, and existing preventive and control measures. Protection from zoonotic disease for pets. Acquire pet only from a reliable dealer who practices good sanitation. Do not attempt to take wild or sick animal or monkey as pet. Keep your pet clean and properly housed. Practice good hygiene. Wash hands thoroughly after playing with or handling your pets. Wash hand after cleaning the cage or aquarium as well as after handling an animal or pet treat and before handling food or eating. Pregnant women should avoid cleaning of cat carrier for toxoplasmosis and eat its feces and cage to avoid contacting of toxoplasmosis. Toxoplasmosis cause abortion in pregnant women. Do not let it lick your face. Keep pet utensils separate. Keep pet out of people's bed. Health education to the public should be given highest priority. The high risk group should be protected by administration of specific immunization. Infected pet and the area where the pet commonly resides should be treated with appropriate insecticide for flea, ticks, mites, and their larvae. Have a veterinarian check over a new pet and provide needed immunization. Example of disease of transmission from different species of domestic and companion animal. Domestic companion animal dog, hydatitis, visceral larva migraine, VLM, cutaneous larva migraine, CLM, rabies, leptospirosis, cat, rabies, toxoplasmosis, lovebird, psittacosis, ornithosis, ornamental fishes, erysipelas, equine, eastern equine encephalitis, western equine encephalitis, Venezuelan equine encephalitis, glandar, cattle में food and mouth disease, FMD, rabies, cowpox, milk nodule, bovine spongiform encephalopathy, brucellosis, leptospirosis, campylobacteriosis, anthrax, sheep, Q fever, leptospirosis, listeriosis, brucellosis, anthrax, goat or brucellosis, leptospirosis, anthrax, pig, trichinosis, erysipelosis, salmonellosis, anthrax swine, influenza, Japanese encephalitis, poultry, avian influenza, pneumococcal disease, virus, conjunctivitis, listeriosis, mycobacterium avium, toxoplasmosis. Role of wild animal in the transmission of zoonotic disease. Role of wild animal in the transmission of zoonotic disease. Wild animals are the known host to the wide range of different microorganisms. Wild animal disease may be expressed as frank disease or silent infection, but many infections of man and domestic animal exist silently in wild animal species as infections which are not apparent. Many emerging and salvific zoonoses are being reported with increasing frequency in man and animal like the orphan virus, enterovirus, myxovirus, herpes virus, infectious present in the wild from zoonotic foci. Alternation in the environmental for the human welfare such as contraction of dam, canals, deforestation and tilling of the grassland for agricultural development may enhance the enhance of human contact with the foci of infection. Rat, mice, monkey, bat, foxes, whale, skunk, migratory waterfowl, duck involved with epidemiology of zoonotic disease. Example monkey. Deforestation in Simonga district near Mussoorie, Karnataka, India result in the outbreak of the Kanasur forest disease KFD in human due to migration of carrier monkey through an epidemiological cycle of monkey tick migratory bird. Arthropoda bone tick-borne zoonosis. Monkey are the reservoir for yellow fever in human tick typhus, Crimean hemorrhagic fever, Q fever, tularemia. Migratory bird, avian influenza, West Nile virus, WEE. Sunken ferret, bad fox, wild dog, and cat rabies. Role of cold-blooded animal and non-human primate in transmission of zoonotic disease. Role of cold-blooded animal and non-human primate in transmission of zoonotic disease. Role of cold-blooded animal in transmission of zoonotic disease. Zoonotic disease which are transmitted from cold-blooded animal called as poikilothermic zoonoses. Cold-blooded animal like fishes, lizard, snake, tortoise, turtle, toad, and frog, which are associated with human population, act as reservoir host for many zoonotic diseases. Aquatic animals live within an environment of potential pathogens in closed systems. However, the concentration of microorganisms may be amplified, increasing the risk of human infection. Aquatic microorganisms associated with zoonotic infections are Aeromonas hydrophila, atypical microbacterium, Campylobacter species, Adversella treda, enteropathogenic E. coli, enterococci, enterotoxic E. coli, E. Staphylococcus species, Legionella pneumophila, Pseudomonas species, Salmonella species, Vibrio parahemolyticus, Vibrio vulnificus, Vibrio folialis, Yersinia enterocolitica. To avoid contraction of poikilothermic zoonotic disease, the following measures should be followed. Practice of proper hygiene. Hands should always be washed with an antimicrobial soap after handling cold-blooded animal or working in the environment. Any open wounds should be covered to prevent entry of pathogens. Immunosuppressed individuals should avoid exposure to potential pathogen. Person with ill health should not handle animal or their environment. If an injury does occur while handling an animal or working in its environmental, proper first aid must be applied. Disease transmitted from cold-blooded animal. Fish, turtle and toys, snake, lizard, frog and toad. Role of non-human primate in transmission for zoonotic disease. Gorilla, orangutans, macaques, and colobus are playing major role in transmission of genetic disease. Example: poliomyelitis, simian malaria, monkeypox, herpes virus. For monkey is closely associated with human varicella zoster virus. Role of birds in transmission of genetic disease. A poultry farm worker who works on a farm where domestic fowl are bred and raised for egg and or meat. Poultry farm workers may contract from the fowl in their care infectious diseases that are common to fowl and man. The atmosphere in poultry farm usually contains significant level of agriculture dust and toxic gases which put the workers at the health risk. Some chemical used at poultry farm for disinfection may cause harm to workers' health. The poultry farm workers work is often physically difficult and involves handling heavy load, uncomfortable posture and movement. This may cause traumas including falls, back, arm and hand pain. Preventive measure Preventive measure: wear safety shoes with non-skid sole. Wear appropriate eye protection. Consult a safety supervisor or a supplier. Protect hand with chemical resistant glove. If impractical, use a barrier cream. Install effective exhaust ventilation and air conditioning to prevent air contamination and heat or cold stress. Wear a respirator to avoid inhalation of dust or aerosol. Replace formaldehyde as a disinfectant with less harmful substituent available on the market. Maintain a high level of personal hygiene at the end of work, shower and change clothes. Do not take work soiled clothing home. Learn and use safe lifting and moving technique for heavy or acquired load. Use mechanical aid to assist in lifting. Role of pet and laboratory animal in transmission of genetic disease. Role of pet and laboratory animal in transmission of genetic disease. In addition to dog, cat and birds which are the most frequent house pet, rabbit, rodent, fish and turtle are also vertebrate species that commonly share the home environment. Lizard, snake and ferret are less common pets. These species can transmit numerous diseases, especially to children who are more likely to be in close contact with them. Although most zoonoses contracted from pets are relatively rare events, clinicians should be aware of any animal exposure, especially in immunocompromised hosts, because of the diversity and the large size of the pet population. Exposure to animals should be systemically ascertained when examining a patient. Genetic disease acquired from rabbit. Genetic disease acquired from rabbit. Biting is uncommon, but rabbit can inflict painful scars with their rear limb if improperly restrained. The genetic disease transmitted from rabbit by contact are Pasteurella multocida, cutaneous infections in human, salmonellosis, yersiniosis, tularemia, Yersinia pseudotuberculosis, Firmite ascariosis, Calill dermatophytosis, fungal skin infection, Trachophyton mentagrophytics, genetic disease acquired from rodents. Rodent, especially mice and rat, are definitively associated with transmission for of major fetal disease to humans such as plague, typhus, and leptospirosis. The albino rat, domestic variety of the brown rat, and the albino domestic mouse are kept by many people. However, guinea pig, hamster, and gerbils are the most common house pet among the rodent group. Contact transmitted zoonoses from rodents are guinea pig, salmonellosis, salmonella, enteritidis, but typhimurium, mouse, natural reservoir for lymphocytic choriomeningitis, C. LCM virus, an RNA virus of the Arenoviridae family, through contact with infected aerosol, direct animal contact, or rodent bite, transmitted among rodent horizontally through secretion, urine, saliva, feces, and vertically the embryo, especially in mice. Infected offspring develop a persistent infection and shed the virus during most of their lifespan. Rat and mice dermatophyte tinea favus trigophyton cucumin. Mice and guinea pig dermatophytosis by transmitted zoonoses from rodents. Pasteurellosis, Pasteurella matosida, red white fever, shodoku, Haverhill fever. Rat are healthy carrier of Streptobacillus moniliformis or Spirillum minus in their nasopharynx. Tularemia, rabbit fever, Francisella tularensis, rabies, Yersinia pseudotuberculosis, and Yersinia enterocolitica. Guinea pig are very commonly infected Campylobacteriosis proliferative illetitis, a specific enteric syndrome of hamster, is probably caused by a strain of Campylobacter species. Hamster certainly represent a potential source of human infection. Other diseases from rodent plague, leptospirosis, L. enterogens, ceroverbellenum, that are known to harbor and shed for long period of time various leptospira, enterogens, cerovers, hemorrhagic fever with renal syndrome or Korean hemorrhagic fever, rodent-borne viral disease, hantavirus, cystodiosis, tapeworm, hymenolipiosis, Hymenolipsis nana, the dwarf tapeworm in hamster, and Hymenolipsis diminutiva, primarily in children, by injection of egg from fecally contaminated fingers or from contaminated food or water. Ascariasis, Traxaceras kb, guinea pig, genetic disease acquired from turtle, lizard, snake, and aquarium fish. Poikilothermic zoonoses. Turtle, salmonellosis, salmonella, Hartford, salmonella infection can only be acquired from lizard or snake, frogs, or aquarium fish. Other gastrointestinal bacterial infection from cold-blooded animals. Edward Silera tarda, goldfish, catfish, Plesiomonas sigilioides, mouth rot disease fish, Yersinia enterocolitica, frog and fish, Mycobacteriosis by aquarium fish, Mycobacterium marinum, swimming pool granuloma, Mycobacterium fortunum, and Mycobacterium platyphylocytis, Melioidosis, Burkholderia pseudomallari fish, Erici Pelothrix insidiosa or rugiopathy, face skin lesion in man known as fish rose. Pentostomiosis. Pentostomiosis armillifera species are worm-like arthropods that are almost exclusive parasite of the reptilian respiratory system. Snakes are the definitive host. Wild rodents on which snakes feed are the intermediate host. Female parasite deposit egg in the respiratory cavity of the reptiles. The eggs are expectorated or swallowed and then eliminated with the feces. Humans are accidental hosts by handling infected reptiles and placing contaminated hand to the mouth. Zoonotic disease acquired from ferrets, rabies, influenza, salmonella infection, Campylobacter jejuni E. coli, cryptosporidiosis, tuberculosis, listeriosis, parasite toxocara, Diphylidium, dermatophytosis, Microsporum caninum. List of zoonotic diseases acquired from pet rabies, rodent, lizard, snake, fish, and rabbit, mouse. rat, guinea pig, hamster, gerbils, squirrel, turtle, lizard snake, fish, fish, parrot. Thank you.